Here at CMU, we actually run the show. We do all the traumas and we do all the procedures. So it's training in an environment for emergency medicine uncomparable to many other programs out there.
It is unopposed, and that is a great benefit of this program. You're going to be doing all of your splints, your reductions. You're going to be leading the trauma cases with the trauma surgeon. It'll be your responsibility. So there's no doubt in my mind that you're going to leave the program knowing what to do as an independent doctor. You're going to learn medicine no matter what program you're at, but the thing that sets this one apart is that you get a family out of it too. You're gonna get very close to your colleagues, you're gonna get very close to your mentors, and you're gonna have all the tools you need that if you do wanna jump into fellowship later, or if you do wanna jump into some sort of medicine field after this, you'll get all the right tools you need to get there.
This facility is an incredible state-of-the-art, high-fidelity simulation center that takes our training to the top. And we basically have curriculum that targets the learner from the very beginning all the way through their senior year. When you come out of this, you're going to be excellent at running resuscitations. You're going to be well-trained for that.
It starts from this terrifying, nerve-wracking experience to, wow, look at yourself 2 years later and you're comfortable, you know how to use everything, you know your resources, you're taking care of your patients, you're confident. And I think it translates well when we start working our shifts in the ER and you see our transition from our first year to a third year.
We live in an area here in the Tri-Cities that is, centered in essentially what is like an urban area. But we also then, within 15 minutes, are living in an area where you can literally drive and be in an agricultural area and have a very rural setting.
Even though we're a Trauma 2 center, we still get plenty of Trauma 1s. You will see everything that you need to be prepared in emergency medicine.
If you train here and you're tough enough to get through our program here at CMU, you can go practice emergency medicine anywhere.